And I want to welcome everybody again to another episode of The Lighter Side with me, Dr. Ortiz, a bariatric surgeon gone rogue. Because it's all about metabolic wellness, not just surgery. But surgery helps, it's an awesome tool. And this is a lighter view on a heavy topic, and we try to make it as light as possible. It's going to be 20 minutes today, and we're going to break these segments apart and then upload them to YouTube because every segment has a valuable piece of information, and we always take into account everybody that's out there. So please post your questions, and we're gonna pick the most representative ones, and the next following episode we're gonna answer them live and actually say your name if you want us to say your name. But anyways, we have the section of questions and answers, latest news if there's anything to talk about relevant, and of course an interview with a patient. And today I'm gonna do it the backwards because we're going to start off with the interview, and then because my interview today is with somebody from the healthcare profession, well, why not share the questions and answers with her? So today, for our interview with one of my patients, is none other than Stacy Lynn. She just had surgery, and we were talking a little bit before this broadcast, and she's already lost so much weight. I'm like, wow, this is amazing. But anyway, Stacy, welcome to the program.
Thank you. Thank you for having me.
Well, thank you for well, first of all, for trusting us. So
Of course.
you're a nurse, right?
I am. I've heard the rumor that you operate on a lot of nurses and doctors too.
Well, it's your fault because you've done so well, overachiever you, that then you walk around and the first thing that they're going to ask you is like, "You went to Mexico? What's Mexico?" And but you're a nurse. It's like, yeah, and I did my research, and that's why. Oh, and then suddenly half the hospital arrives to TJ to our center because that's how it works. So how did you end up with us?
Well, I decided that I had a friend that had a gastric sleeve and was encouraging me to have it as well. And so I started looking into it, educating myself about the different hormones, the ghrelin, the leptin, stuff like that. And then I decided that the gastric sleeve would be really good for me. I was tired of the roller coaster, the up and down, back and forth. I wanted a tool to help me to maintain. And I found Obesity Control Center, and I got to looking into their certifications. And that is why I ultimately chose OCC, is because of their JACO certifications. Just because as a nurse in the US, it's something I'm familiar with. It's something my facility has, is the JACO certifications. And I kind of know what that means, that you guys are held to a higher standard, that you have extreme patient safety measures that you have to meet, and that the ultimate goal of JACO is patient safety. So I know that if you're JACO certified, I'm in a safe facility.
Damn, I've never heard it better said. Wow. Now, you're an educator. You're an educator, and I understand you're doing a PhD?
Yeah, I'm doing an EDD. I'm doing an educational doctorate right now. Yep. I teach nursing at the local community college.
All right, so people trust you.
That they do. Yep.
So, folks, I'm not tooting my own horn. I could. Sometimes I do. But the truth is, the reason we do these segments is because it goes counterintuitive of saying, why am I going to leave the country? I'm in the best country of the world with the best medical system in the world. Is that correct, or is there something you can add to that?
I've seen, when you tell people you went to Mexico, they automatically think of those episodes on TV of like Botched, oh, so-and-so went to Mexico and they got this horrible infection and blah, 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 blah. And honestly, I've seen my own episodes of Botched in the United States. I tell my students, if a secretary has a bad day, there's a typo on a piece of paper. If a surgeon has a bad day, bad things happen, and we're all human. So it doesn't matter where you go, there's gonna be those little issues anywhere. But really, I looked into OCC and I couldn't find any major issues. So, it's really no different than the US. I was impressed with their handoff at the bedside, the checks that they went through pre-op, post-op, it was very similar to the US. And like I say, things happen in the US too. You can look up any facility, it's all public information. Look up any facility and you can see their infection rates, anything like that. And a lot of times, honestly, as a nurse, I can say a lot of the post-op infection rates is patient caused and not necessarily from the surgery itself. People don't follow post-op instructions.
Yeah, definitely, and that's one of the things where, like, say for instance, I have a patient that understood perfectly that her condition was so that we required a special pre-op preparation. She said, "Yeah, I understand you're working on human tissue," and that's why. I mean, we don't want to run risks, and that's why we ask our patients to lose weight before the surgery and prep nutritionally and prep their protein intake, et cetera, et cetera. Now, a question for you, a completely unbiased question. Let's even remove OCC out of the equation. If I were to ask you, okay, there's obviously a huge need for weight loss surgery in the United States. Not just weight loss surgery, we have to understand it as metabolic surgery. People that have higher risk of having a heart attack, cancer, high triglycerides, high cholesterol, sleep apnea, all these things that are going to get resolved by having surgery. So, if I were to ask you, all right, give us the rundown on what you would tell people that are not in the medical field to look for when choosing a facility inside, especially outside the country.
Well, so when I was actually researching for my surgery, and I knew right away I was going to go to Mexico because my health insurance would not cover bariatric surgery no matter what. And I did price a couple places in the US, and I paid half of what my lowest quote was in the US by coming to OCC. But really, I asked even a couple of other facilities I was looking at that were not JACO certified. I was asking about like this, the surgeon certifications, what kind of accreditations the surgeons had, the facilities, and then just researching to see if there were any like complaints. You can look at the Google reviews, the Yelp reviews, all those are really good as well.
And so you looked outside the country, you found a JACO, a Joint Commission accredited center. Now, we've been Joint Commission accredited for many years, but for those that are listening and those that are going to view this later on, can you briefly explain what JACO really is? Because like I said, I can tell you, or you can go to a website and they're going to say, oh, we've got the best results, we have zero problems, and we are the cheapest, El Cheapo surgery. Come to Dr. Ortiz or whoever you're looking at, and you get the free pair of Ginsu knives, absolutely free if you act now. But wait, there's more. You get the Geopet, and we'll double your order. And that's what you're seeing online because there's this incredible competition, but everybody competes with price. Nobody's competing with quality. And people, unfortunately, with this hope they have that they finally look to the South and they're hopeful, oh, maybe I can change my life through weight loss surgery. And they end up being victims of this trafficking of hope. Why pay this when you can pay that? And of course, it's compared apples to apples. We also do great surgery because self-promoting is really easy. You're never going to find a website that says, well, I'm really not the best surgeon in the world, but you can come down here, I'm cheaper. So what is that third-party accreditation? What does JACO really mean?
Well, JACO for me means that you guys are safe, that you've passed some really rigorous standards. I mean, I've been through a JACO survey at my facility before. I was a fairly new grad, and the JACO people show up unannounced. Nobody knows they're coming. And I'm standing up at the nurses' station. All the other nurses knew as soon as they saw the suits walking down the hall, they better scatter. I wasn't that bright yet. So JACO surveyors show up, they pull you in a room, they start grilling you, asking you questions. Where do you find this book? How do you access this policy? What do you do for these policies? So I know that the facility has to maintain those standards in order to keep their certification.
And it's much like the airline industry. Airlines don't screw up. Why? Because they have a designed system that everybody follows. Now, that equates to safety in the airline business, and it also equates to safety in the medical field. We're held to the highest standards. And again, I do it out of respect for my patients because I know I'm going to get a nurse who's really smart and who's going to go back there and lose some weight and then going to inspire other people. So far, how's your experience? How much weight have you lost?
I lost 18 pounds in pre-op, and my surgery was 5 weeks and 2 days ago. I've lost 15 pounds since, so 33 pounds total.
And how much more to go?
I have another 27 pounds for my goal weight.
Wow, you're down 60% excess weight loss.
Yeah.
Incredible. Proportionate to how much weight you have to lose. And since then, has there been dramatic changes you've been feeling or happening as this weight loss progresses?
So actually, it's kind of funny because when I was in the pre-op, you noticed, and all of the nurses noticed, I have this really weird rash on my arms, and I've had a biopsy done. It's a rare disorder called granuloma annular. I call it an autoimmune disorder because they don't know what causes it. I don't know if it is an autoimmune disorder, but that's just where I categorize it. But my autoimmune rash has improved a lot, which is a huge benefit for me because it's just self-limiting. It's really ugly. It looks like a ringworm all over my arms. And then tons of energy, and everyone says, but you're eating so little, how much? And I'm getting around 1,000 calories a day. And everyone says, aren't you just tired? And I'm like, no, I feel amazing. And so I sleep good. I have tons of energy. I eat a couple tablespoons and I'm completely full. I don't snack on the bad stuff that I used to. I try for my protein first, and I make sure that I'm getting all my fluids in, and I feel amazing.
All right, so you're a newbie at this, and this is going to change your life dramatically. And if I remember correctly, I told you that rash was going to go away, didn't I?
You did? Mm-hmm.
Only been doing this for 25 years. So, anyways, the online questions. There's one online question that says, "What is one of the biggest indicators of success for maintaining weight loss after surgery?" And you kind of are following it to a T because our program that is delivered via email to you in a video format, that little snippets of 3-minute videos, kind of take you by the hand, right?
Yes.
And
Yep.
and this is probably the most important thing. Is I mean, you know it because well, you look like an overachiever, and so far you are. If you stick to the program, there's science behind the program. So I do have patients that actually stray from the program, and that's very typical of surgery being done either in the United States or elsewhere where there is no program. So our program is basically remove the carb load, remove the toxic load, replenish your gut bacteria, and certain things that we teach our patients. What are the tips that you've learned so far that you know are going to keep you from straying from that path?
Well, I know that I can't drink with my meals, so that has been kind of interesting, like trying to figure out how to balance my liquids with my solids. I can drink 5 minutes before eating, so that's what I've started to do, get like 8 ounces in 5 to 10 minutes before my meals. Instead of, I used to do it the other way around. I used to eat and then drink after. So now I've just moved my fluids to in front of my meals. And I always make sure that I do my protein first. And I have learned that in the daily emails that I get from OCC. And then if I have any questions, I just email Lucia and she emails me right back. But it's definitely about the protein, I feel, because it's going to help you stay fuller longer. You're not going to have those cravings from the carbs. And really, that's all you have room for at this stage. Protein all I can get in. I get my 70, 80 grams a day, and that's about it.
That's wonderful. So we tell our patients it's protein and fat. Carbs, you can live without them. In fact, you can live without a carb the rest of your life and not have a problem. And here's a question, an interesting question that basically refers to what we're talking about. Does your stomach stretch eventually? And they've heard yes and no. Yes, it will stretch. Anything in the body stretches when it's put through a force. And in this case, the force is the food. Now, what happens with weight loss surgery is that as you progress, right now, you're saying you can eat very little and you have to prioritize your protein. As the months go by, you'll be able to eat more and more and more to a certain point. What is that certain point? The ideal scenario is that you're eating a third of your typical intake. And patients say, a third of my typical intake? Yeah, a third of your typical. Remember Thanksgiving when you really pigged out? It's like, oh yeah, well, a third of your typical intake is not very, oh yeah, well, it actually is a considerable amount of food. All right. So that's where we want to get you to. And one of the things that we've done is that, here's another slide, is that we've created the IGS. The IGS is the improved gastric sleeve. If good is fine, better is obviously much better. So we've redesigned it to prevent reflux. We prevent reflux through herniated sleeves that can happen easily by the fundic anchoring technique. But most importantly, we created something called the double buttress technique, which is basically reinforcing the staple line to make it leak-proof, but also to make it fail-proof. And that's one of those things that every time I get a patient down here, many of them get referred by somebody who's 7 years out or 8 years out after surgery. And I have to ask you, when you did your research, did you find a tendency for sleeves to either have heartburn or fail? What did you find? What attracted you to these special techniques that we're always vocal about?
Well, I did like that you have your trademark technique, and I found it really interesting because I did find that a lot of people do complain of GERD or heartburn issues after surgery. And I had a little bit of GERD before, not really bad, but once in a while I would get it. But I haven't had a single that I was just telling my husband that last night. I was like, it's weird because since surgery, I haven't had heartburn one time.
So you had heartburn before the surgery, and now okay. Now, for anybody listening, even doctors, they're going to say, no, that can't be true. So you're wrong. You don't know what you're feeling. You must have a lot more heartburn now. And I, I love when this comes out. The technique is designed to not have heartburn. That doesn't mean everybody's going to be free of heartburn when I do the technique, because it's not just the technique down here, it's how strong your esophagus is. Some people have lived with heartburn so many years that their esophagus is so weakened that they're going to have symptoms after the surgery simply because the bucket is not this size anymore. It's much smaller. There's back pressure, and there's going to be some symptoms there. So I love what you just said, because this is why the online live interviews are so important, because I don't know what you're going to tell me. You might be able to telling me the other thing, that you have a lot of heartburn. So it resolved. This is awesome.
Yes, it is.
This is crazy. All right. So there's another question, and this question is from Dorrit, and she says, I heard that OCC has no drainage tubes after sleeve surgery. Why is that? What is the difference? What is the advantages or risk of either technique? And by the way, you had no drainage, right?
No, that was one thing I was thankful for. I feel like the drainage tubes probably are going to increase our risk for infection afterwards, because we're poking another hole through the skin.
Yes, they do. Now, you basically had no catheters except your IV catheter.
No, it's a good thing too, because as a nurse, I would have taken the other catheters out when nobody was looking.
Terrible! I would have kicked you out, or put you to work. Okay, so yes, and this is worth mentioning. We've been doing surgery for 25 years. I've done 24,000 surgeries, mostly on females. Most of it has been ambulatory surgery. For the past 25 years, we've specialized on techniques and we've had extremely good results. A zero mortality rate in 24,000 plus patients at this point, almost 25,000, and an extremely low complication rate. By the way, you remember we were taking some pictures outside in our waiting room. That's what our new facility is going to look like. 3 times the operating rooms, plus an operating room fully dedicated to plastic surgery. People are excited about that.
Yeah, hopefully I'll get to use that in the next year or two.
All right, and plastic surgery again. This is something I was a fellow for plastic surgery here in San Diego before I finished all the bariatric surgery. So I love plastic surgery, and I love how we tailor the new skin, the loose skin, to the new body, and the results are magnificent. Everybody can go to the Facebook page and see the before and afters. They are crazy. I mean, I've had somebody send me this bikini shot and my wife's like, who's that? It's like, well, this is one of my patients. It's like, damn, I want what this girl had. She looks great. So the results are spectacular. Anyways, going back to accumulated experience. If you're going to go to another facility that's going to use a drain, well, go there because they're using the drain because it's a fail safe. It's an escape route. It's when there's doubt, they leave a drain. We've done so many surgeries, and around 20% of our surgeries are revision surgeries, that we have dramatically improved how we do the surgery. Safer surgeries, more expected results, and that's why we don't use the drain anymore. And if we don't need to use something, we're not going to use it. Just like you said, it can be it's an outie, but it can be an innie as well. So yes, it could be the risk of infection. Anyways, let's go to, this is an interesting comment that I found on line in our Facebook group, and it's from Tehila, and she says, why do we need revision surgery? I did the sleeve with OCC and regretting not having the bypass. Why so many OCC patients are seeking a revision? Why not do the bypass as a first option? And why don't the results last longer? I'm 2 years post-op and I can feel the surgery wearing off. Now, I really am about transparency, because you looked online and you found exactly who I am, what we do, what we're about, right?
Mm-hmm. Yeah.
And I had to put that online because it's a question that is already on there online. And I have to say, out of the hundreds of surgeries I do a month, around 20% are revisions. But they're not really my revisions. They're revisions from surgeries that happened in the United States, and many that went down here to El Cheapo Center and that then regretted it because, well, they don't do these advanced techniques, and then they have to get a second procedure to revise them, to rescue them. And that's why we call it the sleeve rescue, the bypass rescue. Having said that, all surgeries can stretch out, and that's why we add a program, because carb craves carbs, and you go crazy, and then you're going to be hungry because you're eating carbs, and then suddenly that pouch starts stretching to a certain point. But there's a limit. If you stretch past the point of 30% of what you used to eat, then you're going to fail. And if you fail, then you're going to need a revision surgery. Now, all surgeries fail. 30% of the conventional sleeve, not the IGS. We found extremely good results with the IGS, like the version that you had. But we've seen that bypasses fail, almost half of them. 42% is published.
Oh,
Now,
wow.
if a sleeve fails, I can go back in and do a sleeve rescue, which is basically folding and micro-calibrating it back to size. But if a bypass fails, what do? It's a point of no return. There's nothing else to do. You can make the pouch smaller, the limbs longer, but now you're talking about losing nutrition and stuff like that. So the reason behind this, if I can get 99% of my patients to their weight loss goal with a simple narrowing of their stomach, why would I give them the aggressive procedure? Did you look into bypasses, or was that out of the question?
Yeah, I didn't look into bypasses. I don't know that I would have went that route.
Why?
Just because of all the nutritional issues that I've seen happen with the bypass. I don't know. I just didn't feel comfortable moving the anatomy around. I feel like the sleeve is just a quick, easy nip tuck and you're done.
And that's exactly what we do. And I urge patients to look at the numbers. So, on average, we're not talking about the IGS, the improved gastric sleeve. Believe me, folks, if you look at our patient load, our patients are doing extremely well. And when they're not, the only thing you have to do is call us up. We'll look at your case. We'll start with a rescue program, nutrition wise, and we'll get you back on track. And yes, like I said, transparency today. I have a patient that came over and she says, Dr. Ortiz, and she was so happy. And she's saying, you know what? I screwed it up. I started eating, indulging, and I screwed it up, and I feel I can eat more. So, out of the maybe 100 pounds she lost, she gained 40 back, and or 30 back, and with the pre-op, she lost 20. Which means that she wasn't doing something right, but she said, you know what? I did it on. But she still came because she needed a touch-up. I said, all right. And she's what's considered one of my failures. And when I looked at my failure, I said, oh, baby, that's one hot failure because she looked amazing. And she was cracking up. And that's what it is. You want to be very judicious about, you want to be very sensitive about if you can really eat a lot more and you're doing everything right, yeah, that's when a revision procedure comes into play. But if you're not doing your part and this is a tool, were you scared of what you would do afterwards? Did that even pass through your mind?
Oh, I worry about it all the time. I think about it every day. You know, if I start going back to the carbs and carb loading again, I I'm going that it's going to be my problem when it stretches out because I'm not following my post-op instructions and choosing my protein first and making sure that I'm getting the nutrition that I need.
Yep, exactly. So I'm glad. And here's the thing: everybody should be. Let's not say preoccupied, but just occupied. That's why this is a program. I tell all my patients this is a tool. And as a tool, it has an instruction manual. And constantly we're upgrading our pre-op and follow-up education program that's conveniently delivered to your inbox through via email and now through our smartphone app is soon to be released. We're still working on it, but this is going to be amazing, and we'll actually be able to track your weight and your body mass index and other measurements like your body fat, your total body water, etc., through the smartphone app because it syncs to a smart scale and wearable technology. So we're excited about that as well. Now, you're on the treating end of, uh, let's say, health in the United States, and it is now known that 9 out of 10 people have at least one indicator of metabolic syndrome, which is either high waist circumference, um, high triglycerides, high cholesterol, high insulin, high uh, uh, blood sugar, or high blood pressure. At least 9 out of 10 people have one of those indicators. And again, you became a believer. I didn't sell anything. You're living proof that there are options and there is hope outside the medical system in the United States. What can you tell people that are looking into this?
Well, I initially started looking because I have had an increasing blood pressure over the past year or two. My blood pressure has been climbing. My A1C, which is an indicator of diabetes or blood sugar levels, my A1C has been climbing. It's not super high, but I do test it every year and it has been climbing. My cholesterol, triglycerides, all of those have been climbing. So I I was starting to think maybe getting the metabolic syndrome. So I don't know. I just decided, I want to forego any issues like, if my blood pressure continues to climb, I'm at risk for stroke. If my A1C continues to climb, I'm at risk for diabetes. So I just decided that for my own health, that this was going to be something I wanted to do.
And have you retested anything?
My blood pressure has been normal, if not a little below normal, how it my whole life. And I have not tested any of my labs yet. No.
Oh, you will be surprised, girl.
Well, I'm sure.
Because 3 weeks later is the average where everything returns not back to normal, even better than normal. So when somebody worries about their health, yes, the first thing we see is our weight. But you got to remember that the silent killers are what we just said: blood sugar, blood pressure, cholesterol, triglycerides, and insulin. Those are the big things, apart from excess weight. And what do they lead to? They lead to heart attack, stroke, dementia, cancer, uh, and these are the things that are killing 70% of the population globally. 70%, 7 out of 10 people that you know are going to die from those diseases. So, why not treat it early? And like I said, your surgery was a 20-minute procedure, a 30-minute recovery, and then we sent you back to your room. How was your recovery, by the way?
Absolutely amazing. I tell people I feel like I didn't even have anything done. I didn't have any pain. I had a little bit of nausea, but the nurses were amazing and gave me meds right away. But I am really strict with my post-op instructions. I think I walked 7,000 steps the night of my surgery in the hallway. And the next day I did 12,000 steps. I went and walked on the treadmill at the hotel, and I've felt amazing since. No pain. It was one of the easiest things I've ever done.
And one of the things that we specifically do is that we have a philosophy called the no touch technique. I'm going to go through very small incisions, quarter-inch size incisions through the abdominal wall. But once we go through the abdominal wall, I split the muscle layer so I don't really cut a single fiber. We go in, do the procedure. As we remove our pencil-thin instruments, the inner lining of the abdomen seals at around 6 hours. The inner lining of the stomach seals at around 6 hours as well. So as long as that's happening, the recovery is spectacular. Of course, you may feel a little bloating, a little nausea, because again, you don't have a bucket now. You have a small little pipe where a huge bucket was, the stomach. And we see the recoveries constantly looking like this. And one of the things that people ask me, what's the difference between you guys and El Cheapo Center? Well, El Cheapo Center doesn't really invest in you. We use pretty high-end anesthetics because we want you to go out or under in a couple of minutes and return from that under in a couple of minutes. And the takeoff and landing are the most important parts of a flight, same as is with anesthesia. So high-end products. There are offerings down here that are crazy priced, the $2,000 and the free pair of Ginsu knives. I don't know how they do it. That's what the staplers cost. So if it's too good to be true, come on, people. And I have to thank you because we are out of time, but this is probably one of the best interviews that I've done because you're a nurse. You surprised me with many of the comments. You're a very smart nurse because you keep on studying, and you're never going to regret keep on studying. You're a professor. You teach, and that's why I love that wall you have on the background. Closing comments, anything you would like to add to this conversation?
Well, I did quote El Cheapo, and I would have saved about $3,000, but a funeral would have cost me a lot more.
Yeah, yeah, and unfortunately, you know what? I agree, and and I kind of feel for people that fall in prey to that because again, it's about hope. So the most important thing is that folks educate yourself, and that's why I have my invited guests, and I want to invite you again, probably 3 months to 6 months from now. Probably 3 months. By that time, you are gonna be like, oh baby, and and by that time you should have all your follow-up tests and stuff like that. And I promise you, you will be amazed and surprised.
I'm sure.
All right, folks. Well, you heard it directly from the source. Uh, Health provider in the United States talking about how the experience was and why she ended up down here at OCC. I love what I do. I'm passionate about what I do, and if I can advance the science, I'm all about it. Anyways, that's it. That's all the time we have for today. watch out for future episodes. Post your comments on our social media, and we'll get to them, and then we'll answer them live. Till next time.